Chronic diseases are the leading cause of death and disability in the United States. 6 in 10 Americans have a chronic disease. That's according to the CDC. Joining me today is Dr. Nithya Setty-Shah. She's a board-certified physician, and she has a special interest in family medicine. Dr. Setty-Shah, thank you so much for joining us.
Thank you for having me.
So what is lifestyle medicine?
Lifestyle medicine is the idea of making your everyday lifestyle better so that you can treat or prevent chronic disease.
You're treating the root cause versus treating the symptoms.
Absolutely.
And how does it play a role within the primary care practice?
Lifestyle medicine plays a great role within the primary care practice. It's really important because it focuses on things like physical inactivity, diet, stress, as well as sleep, and unhealthy habits such as alcohol and smoking.
And it's an evidence-based approach, correct?
Absolutely.
Research has shown that it has some great benefits.
Absolutely.
Can you elaborate on that?
So when we talk about research, many studies have shown that it can help prevent and treat diabetes. It can help bring down blood pressures in those who are hypertensive. For people who are obese, it can definitely make an impact on their obesity. People who have high cholesterol, for example, you can do basically a plant-based diet, a whole foods plant-based diet, and bring those cholesterols down. So definitely it's evidence-based, and there are studies showing this as well.
Now, it has several components to it, correct? Mm-hmm. What are they?
So like we mentioned, there are those components. So the most important thing really is that whole food plant-based diet, somewhat of a Mediterranean diet. And what that means is that we are focusing on the foods that are healthiest. So lots of beans, greens, lentils, lots of vegetables. And we're going to kind of shy away from things like meats, cheeses, dairy, saturated fats, all those unhealthy things, the things that we love because it makes things taste good. So we kind of shy away from those. And that is probably the first component, making sure that the diet is very clean and good. So a low-fat, plant-based diet, as much as you can, is going to be the #1 component. Next is we go into exercise, right? We talk exercise, physical activity, whatever you want to call it, staying active. And so when we talk about staying active, we really recommend about 150 minutes a week of physical activity. And that's about moderate intensity physical activity. So what moderate intensity means is that you're doing something like a light jog, ready? So we're saying 30 minutes a day, 5 times a week. But I don't know about you, but that seems kind of daunting sometimes. That's a lot of time. So I even tell people the other recommendation is about 75 minutes a week of vigorous intensity physical activity. So if you have those little iPhone apps or phone apps that have those little HIIT workouts, if those are high intensity interval training workouts, you can do 10 minutes of vigorous intensity physical activity 7 times a week, and you're getting about 70 minutes in a week. So that's an option when it comes to physical activity. And so that's where I leave it with my patients, and oftentimes if they're working on weight loss, they might need more. Next is stress, right? We want to make sure that our stress levels are good, and this kind of goes along with sleep. So, I really suggest meditation. I suggest finding that time to do the things you love as part of lifestyle, because doing that is really going to benefit the prevention of chronic disease. We talk about sleep. Who has the time to sleep, right? But we really do need to make that time. So I suggest that everyone gets 7 to 8 hours of sleep every night as much as possible, and naps are good. Naps are great. So if you need 30 minutes, you need 60 minutes, take as much as you need in terms of naps, because if you need it, if you want it, your body needs it. So go for it. So that's where I stand with stress and sleep. And then there's the alcohol. So who doesn't like to go out and have a drink or party, right? It's a part of everyone's lifestyle. But we really do recommend that males drink no more than 2 glasses of a standard alcoholic beverage per night, or 1, and for females, about 1 beverage or alcohol serving per night. But we now know that doing less is actually better. So if you can avoid it, the best. And then when it comes to smoking, that's kind of the last one. We just say really shouldn't if you can. Really, nicotine in any form, and there's vaping, those other forms of it, just try not to do it.
So all the components that you mentioned, physical activity, stress, nutrition, less alcohol, less caffeine, do they support prevention, management, and treatment?
Absolutely.
And how do you tailor this to your patients?
So it really depends on what they're coming in with. So if they have high cholesterol, I might really focus on a diet with low cholesterol, but say, hey, if you want to eat some of those fruits or those foods with that naturally have a little bit more sugar, that it's okay. That would be one example. Or if they have diabetes, I might say, hey, let's take out some of those really more sugary foods, but maybe it's okay to have a little bit more foods with low sugar but higher fat that are still plant-based, so maybe some avocado or like hummus or something like that.
Do you have any specific lifestyle choices that correlate with diabetes?
Specifically with diabetes, we really ask people to do that whole foods plant-based diet, but a low glycemic diet. So when I say low glycemic, that means that it doesn't raise your blood sugars too much. So if you had to choose between a banana and a strawberry, the strawberry is going to be better for you, or any kind of berry, really. Or if you had to choose between a white potato and one of those orange sweet potatoes, you want to do the orange sweet potato because it's not going to raise your sugar as much.
So walking doesn't get the respect that it deserves, but it has so many exciting benefits. Can you share some?
So you're absolutely right. It does not. Walking is a great form of physical activity. When it comes to walking, it's been shown to be one of the few physical activities that, when started, people can sustain for the longest period of time. So some of the benefits include preventing lots of the chronic diseases, which we've talked about, but it can also be great for your bones and for your muscles, and people don't realize that. It's a great thing to do with others, and it brings people together. So not only is it great for your physical body, but also great when it comes to social interactions and focusing on that stress component we talked about.
And I know you have a walk coming up soon.
Mm-hmm. We do. We have a walk coming up in mid-February, February 16th at 10 a.m. at the Newport Center Mall in Jersey City. And so when we talk about this walk, when we talk about a walk, what that means is that we do, let me give you a little bit more information. Basically, we do something called Walk with the Doc as part of a program where we do a monthly walk where we talk about a specific health topic. And these walks are aimed at getting people active but also educating. So the walk is part of a program called Walk with a Doc. The program was started by a cardiologist named Dr. David Sagbeer out in Ohio. It was back in 2005. He was really frustrated that people were coming to see him and were not making changes in their behavior. So what he did was he said, well, why don't I walk with my patients? Why don't I do something fun with them? And so he decided to do a walk. And then on the day of the walk, what happened? He had 100 people show up to his walk, and he said, wow, what's going on? And so he decided, hey, if people want to walk with me and talk with me, why don't we make this a thing? And so he started this program, and now there's chapters all over the country of people walking. And so people do these walks once or twice a month, and they do something similar to what we do here in Jersey City.
Why don't we instill this in our kids and start at a really early age so we don't have to come to this and have to turn to lifestyle medicine, right?
Absolutely, and I agree with that because when you make it a part of your value system or a part of your life, it's easier for it to just be. I actually, for example, I have lots of patients who have little children, right? Their kids are younger than 2, and they're like, I don't have time, I'm so tired, what do I do? You know what I tell them to do? I tell them to put on a YouTube video, and I tell them to do their exercises, and maybe they use their kids as their weight. So they use them to squat, they use them to do their side crunches or whatever it is, or you put on music and you dance with your children. So you can start at that young of an age, and maybe when you're older you go on hikes. You do those family activities that involve using your body rather than just sitting on the couch.
That's good advice. And one last question is these lifestyle modifications that you mentioned, going back to the different components, are they similar for all age groups, or do they differ? Do you tailor them to somebody that's 20 versus somebody that's 80 years old?
So let's start. So that's a great question. So for kids, for example, I tell them to try and be physically active about an hour a day, if not more. That's always the goal. And then as they grow older, we talked about those physical activity recommendations, but they kind of stay the same as people get, let's say, into their 60s or 70s or 80s. Because I know that it really depends on the person's fitness level and other physical barriers they might have in terms of their health. So maybe their version of moderate or like jogging might be more of a brisk walk, but we kind of still keep the same amount of exercise in mind. The types might be a little different, but the idea of how hard you're working as a person stays the same.
That is some really good information. Dr. Setty-Shah, thank you so much for joining us.
Thank you for having me.